award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, if you recall back last year, maybe around September, October, prior to the presidential elections, we've had many guests on talking about the election. And one of the concerns we had at the time was the fact that what Obamacare would be doing in the country. And on that show, we've had Dr. Victor Greco, along with many other people who came on the show. And at that time, prior to the election, Dr. Greco stated emphatically what was going to happen with Obamacare. Well, Dr. Greco is here today, and we're going to talk about Obamacare. But I also want to let you know, folks, that I did speak to a person who has this sign and very happy about it. I love Obamacare, and I spoke to this person, and I wanted to find out why, with all due respect, why he thought at the age of 31 that this is the greatest thing since sliced bread with our healthcare system. So before we go into what he said to me, most of you in northeastern Pennsylvania, for that matter in the state of Pennsylvania, know who Dr. Victor F. Greco is. But we do have many other new viewers that are in our system right now, particularly from Kingston, Wilkes-Barre. They all know Dr. Greco. But going down to Pine Grove and into the Harrisburg area, and all you new viewers, I wanted you to know who Dr. Greco is. So first of all, Vic, thanks for coming on the show.
A pleasure, Sam, as you know.
You know, I know you're extremely busy, and I really appreciate you coming on the show, but I want to do a follow-up because but Vic, for people who do not know you, because I always say before you vote for anyone, please know their qualifications. Well,
right.
Before anyone speaks about Obamacare and what people should be looking at, I want them to know who the person is, the substance. So tell our viewers a little bit about yourself.
Well, basically, I took my training at Jefferson, Philadelphia. I was fortunate enough to help develop the heart-lung machine. I was on a team to do the first successful open heart surgery in the world. From there, I continued my surgical training, came back to Hazleton, and I was the busiest surgeon in northeastern Pennsylvania doing open heart surgery, thoracic in general. Many things happened to me during the time of practice, and those of which I'm very proud of, among other things, is I served as advisory committee to the Director of National Institute of Health. This is actually one step below the Surgeon General, federal appointment, and that appointment was made by President Jimmy Carter. I also went down and took over the health department for Governor Bob Casey because it was in a real mess, and he asked me if I would consider retiring and go down as Deputy Secretary of Health and run all of the health clinics, which I did. So I was the Deputy Secretary of Health. I was also President of the State Medical Society. I was the first, during my presidency, we were able to make the first meaningful tort reform in the state of Pennsylvania. I've also testified before committees in Harrisburg and in Washington on health care. I've been chief of surgery at both hospitals. So that's my medical background. And I've had a lot of experience dealing with politicians and, of course, the love of my life, patients.
Well, now, with that being said, okay, the fact that you know, and you were appointed by 2 Democrats.
Yes.
Okay, so this is not a political thing. Because,
I'm a registered Democrat.
Okay, well, so am I, and I just tell you, I should shoot myself in the head because when you look at the Democrat platform, it's certainly what you and I do not stand
Yes.
for. And we'll, you know, and people know how I feel about that. But with that being said, Vic, let's go back. Now, here's talking to a person who's 31 years old, and I respect him. Believe me, I do.
Right.
I mean, and he's been told, and he said, Sam, the reason I think it's great is because, first of all, Obamacare is, prior to Obamacare, healthcare costs were increasing 20 to 30%. He said, you're covered until you're age 26. You got pre-existing conditions. No healthcare companies can just drop you. It stops the doctors from double billing, and if the doctor does something wrong, they go after the doctors, not the hospitals, okay? And it makes the doctor more accountable, just many of the reasons why he says, why he has his sign, I love Obamacare. Now, we talked last year, you know, you were on, and we talked about what Obamacare was going to do, all right? Now, he's 31 years old. Was he sold a bill of goods? I do not know. But let's go back a little bit in history last year and talk about what you said and where we are today.
First of all, and I don't know who the gentleman is, but in all due respects, he's misinformed about a lot of things that he stated. The first one, that because of Obamacare, the cost of practice is decreasing. I beg to differ very strongly with him, because Obamacare is still not reimbursing or putting any money into the healthcare system. So it's not even functioning yet. And the question is, when will it function? I'm not sure, because you see all the problems we're having with it. So that Obamacare had nothing to do with the decrease in the rising cost of healthcare. That was a combination of factors. The combination of factors, one of the biggest one was that the federal government and Medicare and Medicaid have cut back the reimbursement to the hospitals and to the physicians. Not Obamacare. This was what has happened. All of the things he talked about is absolutely true as far as the bill is concerned. But as I warned last year, and we're seeing it happen now, you get nothing for nothing. Unfortunately, Sam, we are now into our second generation of entitlement. People want something for nothing, and that's not going to happen. Common sense says you don't get a free lunch. You've got to pay for it one way or another. Now, everything that he says in there is in the bill, but let us see what's happening. I said, first of all, taxes are going to increase. People poo-pooed that. The fact of the matter is now there are 24 new taxes coming into effect because of Obamacare. People haven't been hit yet because they haven't been hit with it yet, but they will. They will. And these taxes include the fact that if you don't carry Obamacare and are not covered, you're going to be fined $2,000. And the IRS is coming after you. They're going to hire a whole new cadre of IRS. You just saw the latest scandal at IRS. They're going to be out looking. It's going to cost you $2,000. Employers, if they do not have their full-time employees insured, they're being fined $2,000 for each one that is not insured. So what are they doing? And you're seeing it happen now. They're taking on part-time employees, not full-time. And so the workforce is being decimated. As far as the reimbursement, whether the senior citizens realize this or not, there is already close to, let me check the figures. I just took the latest thing on checking these figures. There is a cut in Medicare reimbursement that the senior citizens are going to be paying more for their Medicare of $51 billion. $51 billion are taken out of it. As far as all of these treatments they're talking about, he likes it probably because he figured their children will be covered until they're 28. Nobody can be dropped. That's all true, but there's a price for it. And what's happening is hospitals are not get the same reimbursement, nor are physicians. And because of this, we now have a healthcare crisis in providers. There are, I think it's 21 million people coming into the healthcare that weren't covered before. We need 100 and some thousand doctors just to cover those. So what's happening now? We're going at the paraprofessionals. Now you go to CVS Pharmacy or one of the pharmacies for a so-called urgent clinic where they're going to be treating you for hypertension, diabetes, asthma, and a lot of these problems. You're not going to see a doctor.
Doctor, hold that thought for a minute. I want to go to break. However, we're talking to Dr. Greco. And remember, folks, what the thing is this. Okay, we want you to be educated. And just like he has this information, you certainly can get all this information by Googling whatever you want to Google, and you'll find this information out. You want to talk about taxes? There is a tax that was that's already on Cabela's, for example, shows on their receipt, medical expense tax. I think I may have emailed that to you, Vic. I don't know if I did.
Yes.
The receipt. We'll be back right after this with Dr. Greco. Stay with us. Welcome back to the Sam Lesante Show, folks. My guest, Dr. Victor F. Greco, talking about Obamacare. As you know, you can watch this 24/7, anytime, all over the world, ssptv.com, and my email is sam@ssptv.com. Now, this show, folks, the Sam Lesante Show, is brought to you in part by The Power Frame. Now, you've seen this commercial, folks. This is really amazing, okay? As you can see, I have a picture here of my family. And how many of us, sometimes are looking to plug in our cell phones, the lamp, etc. Well, this is the Power Frame, which has two receptacles. It's right there. You just, before you go to bed at night, you plug it in, and you have it right next to your bedside, and you have your picture. Or you can take this when you go away, if you're traveling, put it in your suitcase, you plug it by the lamp. We're always looking for receptacles to plug it in. It's called the Power Frame. Folks, it is fantastic. I have one. I've been using it. I have 3 of them in my home, right where we plug in our utensils or whatever, but most especially when it comes to iPads or the cell phone. So the Power Frame, how do you get one? Go to thepowerframe.com and hit shop, and you'll be able to purchase one. These are really fantastic, so very convenient. With that being said, let's get back, Vic, as we're talking about Obamacare and about even though the people think they're getting all this stuff for free, okay, we're paying for it indirectly through all the taxes. So let's pick up on that point.
Well, there's no question about it. As a matter of fact, whether the people out there realize it or not, they've already stated the fact that when Obamacare comes in, the cost of it is the premiums, just the premiums we have to pay as senior citizens, and those people who will also be covered by Medicare or by Obamacare. They are predicting a 15 to 20% increase per year.
So how does
15% to 20% increase in our premiums.
Okay, so now what you're saying is this young man who is 31 years old, who has an insurance policy, health insurance policy, he could be affected by 15 or 20%?
Absolutely, and in some insurance companies are increasing up to 47%.
Okay, so now to attest what you just said, I called my insurance carrier this week and I asked for different things, and if I wanted to make a certain move, they told me I would be hit with a 30 to 40% increase.
That's right.
So I wanted to make sure that you were talking and anyone could do that. So therefore, that 31-year-old person is going to get hit with a 15 to 20% increase in health care.
At least, and possibly up to 47%.
Okay, so then what happens is this. When they get the bill, they look and say, wait a minute, I just told Mr. Lesante that it's only increasing 2 to 3% a year, and that they were going crazy before Obamacare came in. He doesn't even know the figures yet because the Obamacare is not even in yet, okay?
That's right.
And the reason why they went down is because they cut Medicare and Medicaid, where the seniors get hit.
That's right.
Okay, continue on, Vic.
Now, the other thing that this gentleman, and I don't say this in a derogatory way, he's drinking the Kool-Aid of Obama, who's a very charismatic figure.
The best.
And the press that won't come out with what the truth is.
Right.
Until now, they're pressed on these latest 3 scandals.
Yeah.
But that's another story.
Yeah.
Now, the other thing it's going to do, and it's already beginning to show itself, there's a decrease in care. The type of care you're getting is decreased. Do you realize right now that there is a cancer medication that a lot of people are on that costs between $2,000 and $3,000 a year? They made a deal with the Democratic Obama administration that they would back the administration with political contributions and push for Obamacare as long as they promised them that nobody else could produce that drug. Now, there's a federal law in the books that says after a drug is in there for so many years, they lose the patent rights and you can make generic medications, which are a lot cheaper. This is one company, one drug, that it can't be done. Why? Can they break the laws anytime they want? This is exactly what's going to happen. We're dealing with Chicago politicians and Chicago type of politics. And we're going to start paying prices. This young man has got to realize you don't get anything for nothing. Yes, they'll cover pre-existing conditions, but your premiums go up. Yes, they'll cover all children until 27 years of age, but your premiums go up. You don't get anything for nothing. Now, on top of that, it's going to take you a long time to get to see a physician because you're going to have physician's assistants, registered nurse practitioners who are going to be screening and seeing the patients for the first 3 or 4 visits before they get to see a physician. So if you have something extremely serious, you'll see it. If not, you're being covered by paraprofessionals. And that's not making it in the meaning way. I'm just making it as a statement of fact. The other thing they're starting to come out with now, even before Obamacare is coming into existence, they're now talking about certain tests are no longer going to be run after 60, 65 years of age. They're now saying that women, hey, at one time a woman had to have a vaginal exam yearly, to have Pap studies done. Now they're talking about, oh no, you don't need it for 4 years. And once you're over the age of 60, don't bother with it. This is the way they're going to try to save money, by not giving care. Now, these are the things you and I talked about on numerous shows. We told them this is what's going to happen. Now it's out there and it's happening. It's happening. Now, it's this other gentleman, I'm not sure what he meant by doctors double dipping, and I'm not sure what he meant by they'll go after the doctors.
What he said was this: if you, example, if you have a surgery be done on your arm, for example, and they want to send another thing on another arm, I'm using examples, that instead of, they charge you for the anesthesiologist, et cetera, for this arm, even though they're doing the same surgery on the second arm, they're charging you again for the same amount of money.
At the same time?
Yeah, at the same time.
That's not true.
Okay.
That is not true. You don't separate bill. Not if the surgery is done at the same time. As a matter of fact, if you do both surgeries at the same time, you take a decrease on your second surgery, as far as the fee is concerned, on most insurance plans.
But you
so
see,
this man is not informed.
Victor, and this is the situation that we have in not only in our area, but unless you are well informed, he's a good kid. He really is.
I'm sure he is.
And he's a great person, but he is so misled by this guy Obama because, as you said, he has the flute and he has all the sheep following him.
That's right.
Any senior who was over 65, a voter for him, should actually put a gun to their head.
That's right.
Because of what they're going to get. And it's, oh no, the lady told me 74. I told you, I'm not voting for Romney. He's a millionaire. What does that have to do with what knowledge, et cetera? And as you begin to see how, I want to hire Obama when he's done, because he's the greatest speaker next to Michael A. Musmano, okay, that I've ever heard. I mean, he could sell anybody. He sold the press. He has all of the elite in his pocket. He has some well-versed lawyers who support him 100%. Okay, why? Aren't they supposed to be smart and intelligent? Do they know something we don't know, Vic?
No, they don't. They're taken in by sweet talk, promises, and if you look at the present time, what he is saying, whatever's out there isn't my fault.
Oh, nothing's his
Whatever's out there is not my fault. And I'm sure we're going to see when the Obamacare crashes and people get the bill for it, he's going to stand there if he's still president. It's not my fault. I didn't know that was in the bill. I think Pelosi said it right when she said, let's pass the bill and find out what's in it. Now we're finding out what's in it. Here's a list. I'm not going to read it.
Go ahead.
But 24 different taxes that are coming in as soon as Obamacare is in effect. 24 different taxes.
What are some of them, Vic?
Let me get
Well,
my
we're going to take a break, folks. So I'm talking to Victor Greco. We're talking about Obamacare. Folks, I know, you think I'm harping, et cetera. First of all, I respect the presidency of the United States. I don't respect this president, particularly on his stand on pro-choice. When you could stand up in front of Planned Parenthood, the first time ever a president stood up in Planned Parenthood. Last year, a record amount of abortions, 383,000 unborn babies were slaughtered, and he says to them, God bless you. We'll be back right after this. Welcome back to the Sam Lesante Show, 24/7, folks. SSPTV.com. Over 2 million hits so far on our website. Sam at SSPTV is my email. My guest, Dr. Victor F. Greco. We're talking about, prior to the election, he talked about Obamacare and what it's going to be, what it's going to doing. It hasn't been enacted yet, folks, and we're already seeing what, Vic?
Well, right now there's 24 new taxes. I'm not going to read them all. I'll give some that directly affect us and hurry you. There's an individual mandated tax once you get the Obamacare. You're paying a tax for it. The employers I've already covered. They're going to be fined. Therefore, they're cutting off employees. There's going to be a surtax on income. If you invest in the stock market or you have income over a certain percentage, you've got to pay a surtax on it for the Obamacare. There is also an increase in the Medicare payroll tax. So instead of the employee saying paying 2%, he's not going to pay 4%. Those people who have the so-called health account, now they can no longer use it for things they did before, as over-the-counter prescriptions or going on the racks and taking off a pain medication. You are allowed to do that with your health service account. Now you can't. What they're also doing is increasing the amount, and this affects everybody. If you have medical expenses whether it's nursing care or medicines, prescriptions, hospital bills, if it comes up to 7.5% of your gross income, you're allowed to deduct that tax-wise. Now what they're doing is increasing it to 10.5%. So they're boosting that 3%. All of these little things are going in here. I don't want to read them all off, but there's actually 24 new taxes that are coming in.
So let's talk about my friends, the senior citizens who I pleaded with, because poor senior citizens who are 60 plus, 65 plus, why should they have not voted for this guy?
For all of the reasons I gave. It's costing them more money. They're going to get less care, not going to have the freedom of choice to their physicians. They're going to be, their prescriptions are going to be cut. That's the type they can. Their tests are going to be cut after a certain time. They're not going to get joint replacements. As a matter of fact, they're also talking now about not putting defibrillators in people after a certain age. That's why. And you asked the question, why did they vote? Because they were promised stuff for nothing. Now, the other night you had an individual on your program who summed it up beautifully. I don't want to mention a name, but this is the thinking throughout the entire country. He said during the presidential election, there were lines going into the polls. Why? Because they were voting for pocketbook issues. They were voting for things they thought they were going to get for nothing. He says this time, you just walked in. Why? Because they're not voting them something for nothing. As I told you and the people out there many times, there was this great parliamentarian that came to this country, and he said democracy is the greatest government there is. But once they realize that they can vote themselves free benefits, it will collapse in 250 years. Sam, we're almost there now.
Well, you know, Victor, it's such a shame, too, because here again, these people who are staunch supporters of this guy and think Obamacare and entitlements, we should be getting entitlements, we should free, all the illegals should be made automatically. And so when you give things away, that's why they love you, okay?
Absolutely.
We had the fight in Detroit where the people are lined up, but where's my money? Obama said he was giving me money, okay? And, you know, everybody has to pay for it. You know, people scratch their heads when they see the abuse of welfare, they see the access, they're scratch. How could they get away with this stuff? Well, keep on giving things for people for nothing, that's what you get.
Sam, if you look at the benefits, the person who's on welfare is earning the equivalent of somebody working at a job for $50,000 a year. Now, who in this area is making $50,000 a year? Why should they go to work?
But they love him.
Oh, whoa, why not?
They think
Why
this
not?
guy, I mean, you talk to some seniors, they still love, until, Victor, they're so, what do you mean I can't have this? What do you mean I can't have that surgery? What do you mean? Well, my mother, she's only 75. Then it's like, oh.
Yeah.
Folks, I welcome the other side. This person, he's a great person. I know him personally. He loves Obamacare, but he is misled from A to Z, okay? Until it affects you, folks. My friends, you seniors, till it affects you, then you're going to see why Dr. Greco has said, beware. This is not a Democrat thing. It's not a Republican thing. It's just bad. My choice is, okay, I'm a pro-lifer, as you know, folks. I've been asking for years to have someone from Planned Parenthood sit where Dr. Greco is sitting, and I will be quiet for 29 minutes. You tell me why you should rip little arms apart, little legs apart, and now they have the young people believing, Victor, my friend who is 18 years old believes that it's not a baby until after 2 months. You could have an abortion. You're not killing a baby. You're killing a mass. That's how they infiltrating these people, okay? But when you find out that you're pregnant, what do you say? Honey, we're having a baby.
We're having a baby.
We're not having a fetus, a mass. This is the destruction of our country. Morally, this guy is killing us. Absolutely killing us.
Where are the liberals on this doctor in Philadelphia who's running a butcher shop? Actually severing with the scissors the spinal canal, the spinal cord of a baby while they're still alive. If he walked in downtown Philadelphia with an AK rifle and began to shoot and kill that many downtown, Planned Parenthood, all the liberal press, everybody be screaming. Not one word from them.
And you want to know why the country's going down the tubes?
It's down the tubes.
It's sad, folks. Welcome your comments. Remember, you liberals, you know why I'm after you? This is what you're doing to our country. We'll see you next time.